Mr. H is a 60-year-old male with metastatic cancer whose pain level is 8 out of 10. He's concerned about his pain medication and his pain level.
Okay, so we finished your assessment. Now, do you have any pain currently?
Yes.
Okay, how would you rate it on a 0 to 10 scale? 0 being you don't feel anything, 10 being I am taking a sledgehammer to your knee.
Probably an 8.
An 8? Okay, where's the pain located?
It's kind of everywhere.
Everywhere? It's kind of generalized to everywhere? Is it muscle pain, like you've just been working out and you're really sore, or is it more located in your joints?
Usually I'm pretty sore, but I guess it's kind of like a really like aching joints, and after like a long day at work, it's like I'll sometimes have like a stabbing
Right.
down my legs.
Okay, does anything make it better or worse?
Usually just trying to relax, or like probably a hot shower.
A hot shower helps? Okay. Now, have you taken anything to try to help your pain?
Well, the doctor prescribed me Percocet, but I'm afraid to take it as often as I need to because I'm afraid of addiction.
Have you had any history of addiction or anything like that?
No.
No history? What makes you afraid of addiction then?
Just basically what I've seen on television.
Okay. Well, so long as you take it as prescribed and you're taking it for pain and not just because, you shouldn't get addicted to it. So that's not something you should be concerned about.
Mr. H, I've prepared a PowerPoint on information on pain medication, and metastatic cancer. I hope it can answer some of the questions that you had today. Mr. H, I wanted to review what metastatic cancer was. So, metastatic cancer facts. Metastatic cancer is cancer that has spread from the one place in the body where it started to another place. Metastatic cancer also has the same name and same type of cancer cells as the original cancer. The most common sites of cancer metastasis are the bone, the liver, and the lung. In your case, the cancer has spread to your bones. Mr. H, I hope this slide explains a little more on why you're having the type of pain you are. When prostate cancer has spread to the bone, it produces substances that can damage and weaken the bone, which can increase chances of breaks and fractures. As the tumor begins to grow, the nerve endings send pain signals to the brain. Bones also may harden. This is a process called sclerosis. Right now, your prescribed pain relief regimen is Percocet as needed for pain every 4 hours. Be sure to take the medication at the onset of pain for best results. If pain control is not adequate, speak to the doctor about the possibility of around-the-clock dosing and change in medication. It is important to note that pain management cannot always relieve all pain. Right now, your pain level is 8 out of 10. We cannot realistically get it down to a 0 out of 10 very quickly. So for a short-term goal, we are going to try to get it down to 4 out of 10. Mr. H, I'm hoping the next several slides better answer your questions pertaining to Percocet. Percocet is an oxycodone and acetaminophen combination analgesic. Acetaminophen allows the oxycodone to be more effective at lower doses. However, excessive acetaminophen can cause liver damage, so daily intake should not exceed 4 grams. So be sure to check all medications for acetaminophen. Do not exceed prescribed dosage amount or take more often than prescribed. Like all medications, Percocet has common side effects such as lightheadedness or dizziness, drowsiness, constipation, nausea or vomiting, postural hypotension. In the case of lightheadedness or dizziness, do not drive or operate equipment until you know how the medication will affect you. For constipation, increase fluid intake and add bulk fiber to your diet. The doctor can also prescribe you a laxative if needed. For nausea and vomiting, take medication with food to reduce GI upset. Postural hypotension, make sure to change positions slowly to reduce dizziness. Be sure to also let your doctor know if you take any prescribed medications, over-the-counter medications, or herbal supplements before starting Percocet. This is important because of certain medication interactions. Mr. H., earlier you expressed your fears about addiction. I put this slide together in hopes to teach you a little bit about addiction and how it differs from physical dependence and tolerance. Addiction is a concern for many people prescribed opioids. Many people mistake physical dependence and tolerance as addiction. Physical dependence occurs with the continual use of opioids. This is characterized by a withdrawal syndrome. It is important that the drug is not stopped suddenly, but that the doses are gradually reduced. Tolerance occurs with the continual use of opioids and is characterized by the need to increase doses to maintain the same degree of pain relief. This is managed by rotating opioids. Addiction to opioids is characterized by drug-seeking behaviors and the need to take opioids for purposes other than pain relief. When opioids are taken for chronic pain relief, addiction is uncommon. It is important to keep pain under control and understand how opioids help accomplish this goal. Before we move on to discuss different types of pain management therapies, I would like to identify current ADL ability. Discussing and determining current abilities of ADL's activities of daily living due to current pain levels can provide a baseline as well as awareness of future potential needs. Planning and problem-solving potential issues can provide a sense of control over current and future needs with a focus of maintaining independence. As mentioned before, you still work as a janitor. Does your work seem to be affected by your current pain level? These are the types of questions that I will be asking when assessing your ADL ability. I will now start teaching you about pain therapies. The first thing I would suggest that you do is start keeping a pain journal. A pain diary or journal is just simply a diary in which you will record your daily pain. Record your pain on a scale from 1 to 10, 1 being the least amount of pain, 10 being the worst amount of pain. Record when your pain occurred, where the pain was located, type of pain like throbbing, burning, tingling, the activity you were doing at the onset of pain, what you did to relieve your pain by taking medications or other therapies, then rating your pain in another hour to see if the pain was relieved from your medication or therapy. Keeping a pain journal can help you and your physician understand your pain triggers. A pain journal can be instrumental to an effective pain management plan. There are many different types of therapies that you can use to help reduce pain. Massage is one of them. The benefits of massage relate to its effects on the musculoskeletal, circulatory, lymphatic, and nervous systems. Massage also positively affects mental and emotional states. There are 3 types of massage: superficial massage, which consists of brisk strokes or circles across the skin; deep massage, which consists of firm pressure to the skin; and trigger point, which consists of strong, sustained pressure. Traditional Chinese medicine can also be used to help alleviate pain. One of these is called acupuncture. Acupuncture involves the insertion of fine needles underneath the skin surface and is the most common complementary therapy recommended by U.S. physicians. When energy is blocked or congested, illness and pain can occur. Acupuncture works by accessing and releasing blocked or congested energy in the body. I would also like to suggest something called art therapy. Art therapy is based on the idea that the creative act can be healing. According to practitioners, also called art therapists, it helps people express hidden emotions, reduces stress, fear, and anxiety, and provides a sense of freedom. Many art therapists also believe that the act of creation influences brain wave patterns and the chemicals released in the brain. Art therapy encourages you to express your emotions, which could help improve your relationships with other people, encourages you to be creative and self-confident, helps to control anxiety, depression, and low self-esteem, and also can help take your mind off pain or discomfort by distracting you. Art therapists work with people with a variety of problems, including chronic or life-limiting illnesses, including cancer, mental health problems, including depression and addiction, relationship problems, eating disorders, learning and behavior problems in children. What art therapy involves is drawing, painting, and sculpture work, dance and creative movement, drama and poetry, photography, looking at and evaluating other people's artwork. The reason I suggested this therapy is because I think it would help in reducing some of your pain. There are many community resources out there that I am encouraging you to explore and utilize for your independence. These community resources can provide patient support, realistic pain management goals, and coping mechanisms to deal with chronic pain. Examples of such services include home health care, pain management agencies, cancer support groups, and hospice. I would recommend pain management agencies to help make realistic goals, and cancer support groups because such groups can be very therapeutic. I would like to end this by teaching you about proper rest because it is very vital to your overall health. Getting enough sleep at night is essential to feelings of well-being. This will help control pain levels. Try to get 8 full hours of sleep at night. Be sure to take frequent rest breaks during the day. If pain interferes with your ability to sleep or quality of sleep, ask your doctor about options for pain relief at night. This was everything we covered today in our assessment, and I hope that this was very informative for you, Mr. H. If there's anything else that you have questions about or concerns about, please feel free to let me know, and I will try my best to help you.